My name's Tad Vischer. I'm local from here in Vincennes. I've been a respiratory therapist for 20 years or so. I've been working up here for the last 10 years in home care and then here at Good Samaritan Hospital.
My name's Elizabeth, and I am from Good Samaritan Hospital. I work in the respiratory care department. I have been here almost 40 years.
What do I love about my job? My job is different every day. I get to interact with the staff on a personal level. I get to interact with the patients on a personal level. It's not the same thing every day.
I love being able to interact with the patients. I have always been one that likes to get to know my patients, and I feel the communication is better, and it makes the patients feel more comfortable when they've got someone that is trying to make them feel comfortable and at home.
My job is different in just the amount of time it takes to deal with patients. So we still see these same people. The workload may be higher, but we adjust staffing accordingly. But the prep time. So if I go see you in a room and you've got COVID, it's going to take me 4 to 5 minutes to get my equipment on. It's going to take that long to get it off, and it's patient to patient to patient. So it gets kind of taxing wearing all the extra equipment. And the lack of families here for emotional support for the patients. We get tied up in these rooms because we're in healthcare, because we care, and we listen. It's not because we don't want to. It's basically we have to. They need an outlet, so we're there, and we spend time with these people on a personal level because frankly they just don't have that outlet.
Well, some of the days are heart-wrenching because you see a patient come in and they are somewhat stable, and then as the day or the days go by, you can see them deteriorate. Some of the patients become weary because they are isolated. They're not able to be one-on-one with family or friends. There are days when it's overwhelming to the fact that you have people desaturating and they're doing it at almost the same time, and you're changing the oxygen from one type of oxygen mode to another type, and it does become overwhelming.
My biggest struggle would be not wanting to take the virus home. I mean, I don't want my family to be affected with this because it is a real virus. This is no joke. We're seeing people die every day. And the other frustration is, unfortunately, death has become the norm in healthcare, which is something that we're not used to seeing. I am so over seeing people die. It gets tough to see.
It does get to where you yourself become emotional with that patient, because if they have been isolated, they want to talk, and you've got to make yourself available to do that. And it is very important because a person needs to have that touch, hold the hand. They need to know that you are there for them and that you're giving them the best care that they can get. And don't leave them with any doubts. Just try to make them feel that they are the most important thing, because they are.
People really need to understand that there are people up here that don't have family members coming in. I mean, so they do get to have somebody come up, but they're 10 to 12 feet away looking through a piece of glass. it's not fair to them. It's not fair to their family. People need to understand it is really real, and frankly, the people dying without loved ones by their side is something I can't imagine.
It's rough because if a patient is on a ventilator for days, you can see their physical appearance change. There's so many things that happen.
The one thing we are doing different now is we're proning these people. So we basically, they're not laying on their back and we're not rolling them side to side. We put them on their stomach so that we can get more oxygen in the bloodstream. So we're getting breakdown on people's face. We're getting sores. They're getting sores all over their body from the shearing from the sheets, rolling these people around all the time. So frankly, and once you put them on the ventilator, I mean, they're on for a while. So the body's going through a very, very stressful situation, and it's the response to what we normally do. You can see it physically on the body.
Devastated, because some of the patients, when they've been here for a while and you've saw them start out at mild, and then they've gradually over the days just deteriorated, and then they get on a ventilator and they may be on ventilator for a number of days, and when they do die, it is heartbreaking, not only for you, but you think of the family. You think of that poor patient that has been there and their family has not been able to be in physical contact with them. And I do hate that thought. And the idea of a person, they're not dying alone because we're all there, but it's not who they know.
Well, COVID is real. I wish you guys could come in and see it for yourself. I encourage everybody to be smart. Use your mask in public places. Obviously, if you're in small groups and around your family, you just be smart about it. You don't have to be a hero here, but just do your part. We're not asking for a whole lot. Just put the mask on. I don't want to wear the mask either, but if it saves your loved one from getting sick, then I would like to think that the same would be reciprocated from you all.
It is very important to do, again, the masking, the social distancing, the hand washing and sanitizing. It takes all of us to make this successful in the fact that this COVID is going to be with us for a while, but we still need to do all these things in order to bring the numbers down so that we can go back to our normal daily lives.
Working around this every day is totally different than anything any of us in healthcare has done before, but we're trying to do our best, and if you help out, then maybe we can get back to somewhat of normal life sooner rather than later.